Hello, I am Dr. Venkataram Mysore, Dermatologist, hair transplant surgeon, Venkat Center for Aesthetic Health, Vanashankari, Vijayanagar, Cunningham Road, Bengaluru. Frequently people come to us and ask, Doctor, I have got this mole, should I remove it? Doctor, this mole is recently increasing in size, do I need to bother about it? Doctor, I have got so many skin tags, look so ugly, what can I do about it? And I am answering these questions through this video. Moles are of different types. Moles means an excess of tissue. That excess tissue can be pigmented when it contains cells called melanocytes. It can be skin colored when it contains tissue called epidermis. It can be red when it contains blood vessels. So mole is not one term, but when people commonly say moles, they mean these black colored moles which people have. What we call nevus. Nevus is the medical term for moles. In that there are pigment producing cells which are called melanocytes, nevus cells, which accumulate congenitally. They are all congenital in origin. That means that those cells are there since birth. They may appear at different times in life. In somebody it may come during childhood, in sometimes it comes during puberty, many times it comes during pregnancy in women, and so they can keep happening throughout life. Moles have a bad reputation because moles can become what is called a melanoma or malignant tumour of the pigment cell. This is extremely common in the Western skin. It is not so common in the Indian skin. In Western skin, it is one of the commonest types of cancers and they can arise in a pre-existing mole, and hence there is some amount of fear about moles. Now in moles, there are several types. One is called congenital, which are present since birth. As you can see here, this is what is called congenital melanocytic nevus. These can be very large. The other one is what is called an acquired nevus, which all of us have. 1, 4, 6, 8, somewhere or the other. In fact, is used as a means of identification. For passport and all, you mention I have got a mole on the forearm, mole on the cheek, etc. Now in this, the mole can be flat, as you can see here, called junctional nevus. It can be slightly elevated, called compound nevus, as you can see here, or it can be pedunculated or a nodular or bulbous nevus, what is called intradermal nevus. Now, when does one worry about mole? I want to assure people here that in India, most moles do not turn malignant. So, do not be paranoid about it. In Western skin, it is different. They also have a type of nevus called dysplastic nevus, which can become malignant. So, that's a Caucasian skin, particularly if they are living in sun areas, if they are not using sunscreens, their situation is different. In India, generally, moles do not have to cause any fear. Do not be afraid. Moles are removed when there is a suspicion that they are changing character in their behavior. Means becoming larger in size, becoming itchy, becoming red, border becoming irregular. These are worrying signs, then you remove them. Otherwise, people just don't like sometimes. I don't want to have so many nevus, so they remove it. How do you remove it? If there is a suspicion of their behavior, if there is any fear that they may turn malignant, then you remove it by surgery. There is no other method. You have to remove it in full, preferably with a margin, then study it under the microscope. Because you need a report, they are benign, they are malignant, they are intermediate, whatever. If they are being removed for a cosmetic purpose, as is the case in lots of individual Indian patients, then you can remove them by several means. One common method is what is called radiofrequency. It's an energy machine. You can use lasers of different types. One laser is what is called Q-switched Nd:YAG laser, which is one of the commonest modalities to use the laser. Carbon dioxide laser can also be used to remove the laser. 1 to 3 sessions are needed. Please understand this. It may not go in one session, 2-3 sessions may be needed. Sometimes they are little larger. Then they are removed and you put a stitch, small plastic surgery. That also is done if the lesion is large. Small lesions, machines, devices, energy devices, lasers or radiofrequency is usually enough. And once it is removed, we have to see whether there is any possibility of recurrence. Now, if the mole is a deeper mole, then removing it may produce a scar. If it is not removed properly, then it can recur. So that is something which one has to keep in mind. So, the success rate after removing the mole depends upon whether it is completely removed or not. So, either surgery or machines can be used depending upon the type of nevus or mole and the number of moles, depth, etc. Now, this is about moles. Now, there is one type of mole which is somewhat difficult to remove, that is called congenital melanocytic nevus, that needs extensive surgery. That is not the subject of discussion of this lesson.